Hello everyone, this is Dr. Mandeep and I welcome you all to the clinical case series with Nextillo. So, this series is for everyone, including the second year, third year, fourth year, fifth year, sixth year students, including interns and junior residents, because here we are going to discuss the basic, the paraclinicals and the clinicals in the cases where we would integrate each and every aspect of medicine that we learned over the span of 4 to 6 years, right? So let's begin. So the first case that we have is displayed on the screen. And here we go. So this case is a 48 female with nausea and vomiting for the past 4 months. And she says there is no relationship of nausea and vomiting to any food or abdominal symptoms, and this has to be noted. She also experiences headaches, breast pain, for which she takes ibuprofen and paracetamol. With regards to vitals, these are her blood pressure is 130/80, her pulse rate is 68, good volume, her saturation is 98% on room air, the temperature is 98 again, the respiratory rate is 18. If we review her labs, what is there? What's abnormal? So if you see closely, you have hyponatremia. And another abnormality that you see here is low serum osmolality. What's the sodium level? The sodium level is 124. The serum osmolality is 266. I believe everyone noted that. So what's the question? The question here is, what is the volume status of the patient? So to answer this question, we should know which are the volume states commonly asked in the question or the exam. The three most common are hypovolemia, euvolemia, and hypervolemia. I believe it is clear to everyone. To answer the question of the volume status of the patient, we will dive into all three volume states, right? And remember that this patient has hyponatremia, right? So we should be able to answer this another question, which is how these volume states, these three volume states, lead to hyponatremia, right? So let's dive into these volume states now. We have hypo, we have eu, we have hyper. So in hypovolemic states, there is less fluid, right? Hypo means less and hyper means more. It means there is more fluid in the body. More fluid in the body. Since we are discussing fluid status, hypo means less, hyper means more. And in euvolemia, what would happen? There is balance. So what happens if there is hypovolemia in a patient? So since the fluid is less, it would be equivalent to dehydration. You guys are right. So what are the signs of dehydration? Yes, the first sign you could see on the face of the patient is sunken eyeballs. And if you move towards the tongue, you would find a dry tongue. And if you move towards the arms, what would you find? You could evaluate the skin where there would be abnormal skin turgor or poor skin turgor. If you evaluate the pulse, what would you find? You would find the volume of the pulse would be low. It would be a low volume pulse. And the heart would try to compensate by increasing the heart rate, and you would find tachycardia also. Now, if we see the patient, right, the vital signs, you would be easily able to get that the patient doesn't have tachycardia. The volume of the pulse is good, है ना? So it is less likely this patient is dehydrated or hypovolemic, right? So even if you notice the physical examination, let me get into the physical examination of this patient. So the physical examination of this patient particularly reveals that there are breasts which are enlarged, tender, and a white material can be expressed from the nipples. While the rest of the examination is unremarkable, so there are no signs that this patient is hypovolemic. So hypovolemia is ruled out in this patient. We saw that in physical examination there are no signs of dehydration, right? And in the vitals the pulse rate is 68, the pulse volume is good, and the blood pressure is 130 by 80. So if you see that the blood pressure is normal, the pulse rate is normal, the pulse volume is good, you would say that the volume of the patient is not hypovolemic, at least in the present case scenario, right? Let's move towards hypervolemia. So for hypervolemia, there is more fluid in the body, right? So when extra fluid is present in the body, it would deposit everywhere. So if we start with the face, there would be facial edema. And if you think about eyes, there would be periorbital edema. If you see towards the neck, you would find the internal jugular vein would be distended because there is more fluid, right? So there would be raised JVP. Now if you move towards the chest, what you would find? The fluid would be deposited around the lungs and in the lungs. Now if it's in the lungs, it would cause pulmonary edema. And if it's around the lungs, what would you expect? Pleural effusion. And if it's in the abdomen, the fluid would be deposited in the peritoneal cavity and there it would cause ascites. And if we move towards the limb, there would be swelling of the lower limbs most likely, and it would cause pedal edema. Now, if we see our patient, we concluded that with BP and pulse rate, there is no hypovolemia. Now, for us to see if there is hypervolemia or not, we should check out if those signs are present in this patient or not. In this clinical case, in the physical exam, the breasts are enlarged, tender, a whitish material could be expressed from the nipples, right? However, these are not the signs of fluid overload. They are signs of something else, which we would discuss in the later videos, right? So, now we can conclude that this patient doesn't have hypervolemia. So, this patient doesn't have hypervolemia, right? So, what are we left with? We are left with euvolemia. So, this patient has euvolemia. So, let's dive into euvolemia and simultaneously discuss how the other volume states lead to hyponatremia, right? So, this patient has hyponatremia. Hyponatremia, it means the concentration of the sodium would be less in the body. So, if this is sodium and this is water, and if we label here, this is hypovolemic state, this is euvolemic state, and this is hypervolemic state. So in all of these states, let's discuss, right? So in hypovolemia, there would be less water, right? There would be less water. In hypervolemia, there would be more water. And as we discussed, there was balance in euvolemia. But however, in euvolemic state, the total body water in the presence of hyponatremia is more. So, the water content in the body in case of euvolemia and hyponatremia is more. So, now we should approach sodium in each state. Now, the sodium, if it's hyponatremia and the water is less, how should the sodium be? It should be low. It should be low. If the water is low, the sodium is also low. But the amount of sodium is much lower in comparison to water. That is why there is hyponatremia. So, what happens if there is euvolemic hyponatremia? There is euvolemia and hyponatremia. The amount of sodium is usually normal or it could be variable. Right? So, because there is increased amount of water in the body, there is hyponatremia in euvolemia. If we are discussing that state in hyponatremia. Now, if there is hypervolemia and the water content is high, in hypervolemia, the sodium content of the blood is or the body is high. But there is the trick here because in hyponatremia with hypervolemia, what would you expect? Hypernatremia? No, because the water content is much higher as compared to the sodium, you would get hyponatremia. So I hope everyone understood this. So let's recap all these three volume states in hyponatremia. So in hypovolemia, if there is hyponatremia, the amount of sodium is much less. That is why there is hyponatremia. While in euvolemic hyponatremia, what you would get, the amount of water in the body is much higher, so that sodium is less concentrated, right? That is why you would get hyponatremia. And in the last volume state, that is hypervolemia, there is increased amount of sodium and water content in the body, while water content is much higher as compared to the sodium. So there would be hyponatremia, right? So this is where I end my discussion, and there is one question for all of you, right? So what is that question? That question is, what is the cause of hyponatremia in this patient? We'll answer this question in the next video of clinical case series, and I want you guys back again with all the excitement, right? And we will discuss in detail what is the cause and understand the basics of hyponatremia again. I think it was a great learning experience for everyone, and goodbye. Take care.